Ladies and gentlemen, I have been in business for more than 30 years. And one thing that I have found out in over 20 years of being a, a visionary leader in the mental health and behavioral health is that even in their executive and management capacity, in the hiring and firing decisions, and in the review of processes, and also in the performance reviews of people and across different entities where that being in such roles, either in as a compliance officer or even in the areas of quality assurance, in the areas of management and the whole areas or what we call the four walls of healthcare administration is that having a degree in any area of behavioral health and also having a license does not make one a good clinician. We've seen time and time and time and time after people who are graduate and licensed coming to work, but they are not able to perform the procedures that they are licensed to do. Because most of the time people come out of school or rely on what they were taught in school. And even during the clinical rotations, when they were supposed to have, through internship, gain some experience, and they've not been able to live up to the demands of the task. And then I look at it legalistically from the law and regulatory aspect of it, where all procedures are stipulated of what they will be doing. So we might tell you, well, they say you are going to conduct an assessment within no later than the fifth visit, seeing a patient, and then, but you are trained to conduct those assessments. But in conducting those assessments, then it specifies all the areas, the procedure we cover, what you should do, and etc. etc. But your training tells you how to do them. Now, using the tools that is available, which is oftentimes standardized, especially in accredited organizations and facilities like ours, you will have also some performance and measurement criteria that has to be made in order to show whether the person performed the services that complies with those standards or regulations. So oftentimes you find that the clinicians were not prepared and they come to you discussing classroom work, research of what they have been taught in school. But and often we tell them, but that is in a perfect scenario. All the research that supports any evidence based procedure that you perform is done in a laboratory environment where all controls are in place and measured in order to determine the efficacy of the procedure, the process. So, but when you are dealing with human beings, everybody is different and respond to situations differently. For example, depression. How do you diagnose a depression? It gives you this criteria, assuming using the standard in the ICD-10. So these three criteria has to be present, and in addition to any five from this list of other criteria. And assessing those particular criteria is what you obtain from training. Now, in doing so, you will realize that it's not the same for everybody who is suffering from depression, because some people's response and reactions are different, and how it affects people are all different. And there is beyond what you can just only learn by looking at that. There are different things that can make some of those conditions not apparently available at the time. But what if the person decides to hide it and keep those other things from you because they don't trust you? Why should I tell you my business, as in the case with most black people in the world, and especially African Americans, that we want to first of all gain your trust, which might even take 6 months or a year, or a day, depending on how the person feels in the person who is interviewing the individual during that particular assessment. Then the how you also conduct the assessment is also another factor that could have a different nuances, different from what a laboratory experiments that you learned in school offers you. Say, for example, in our organization, we have adopted the motivational interview technique, which is one of the latest technology in that particular process. But what if the person is a nurse or who has been in practice as a physical a nurse in a hospital or in a nursing home, or a doctor who themselves don't have not gained the experience, or a social worker, professional counselors. And then you find that, for example, nurses that like to use the reductionist or reductionist approach or model in the way they conduct those assessments, ask questions that is confrontational, sometimes in a way, especially you talk about doctors that have no bad manners, have no consideration for the person's feelings and emotions as far as how that information that is observing to see whether you are empathetic, whether you're understanding, whether you're going to be judgmental, and the person is analyzing you too to see whether they will give you the answer you want or tell you what you want to hear. So you can see how there are different the nuances in the real person when you do those assessments as a clinician. So you find that you can be the best clinicians in class and graduate with first class or summa cum laude, and then you are now dealing with a human being that also analyzing you and wondering and considering whether they need to tell you what you need to do in order to make that determination. So that is why here at Care Solutions, in our training and orientation, so we have seasoned clinicians, some with a combined experience of probably 50 or 100 years, to be able to guide you and help you when you run into trouble, which is not obtained in a lot of other behavioral health or mental health locations. To be able to see how motivational interview techniques or other techniques can help you to create the kind of trusting and environment, trusting relationship that we allow the bonding, the therapeutic environment that is required, that we allow somebody to put their guards down and actually tell you what is going on from inside of them. Remember, this is about the mind, the brain, and the mind. So that is why at Care Solutions programs like Family Preservation of America, we bring the whole team together in different ways and different approaches in order to arrive at that particular diagnosis of a depression, and continuous reassessment and evaluation to see if additional clinical data has been provided that requires a new clinical decision regarding that particular diagnosis. And this goes on with the whole entire process of that assessment to come up with that diagnosis, and then the treatment plan and the rehabilitation plan and etc. that are required in order to have the best outcome for the patient. So for somebody who's coming out of school, sometimes they get uncomfortable. Do you want to start prescribing medication coming out of school without adequate experience, knowledge and understanding, knowing the risk that could come from your prescription task or duty, or as a psychotherapist, or whether a talk therapy, depending on the model that you choose to address the issues? What is the best way to be able to help this individual that can help them to either heal or recover? So these are the things we not only provide. So one thing that I find from my capacity as an executive in this area that sits in some of these meetings with these highly educated people that are trained in complex processes that are not quantifiable, in the sense that it has to do with the mind and the reasoning and the understanding and analysis of the data, the clinical data that is obtained during such an assessment, is that for a staff who is in this field, like all the people that work for us, because we are very careful during talent recruiting to look for that, is three things that are critical, or maybe four. One is that does the person understand the relevance of research? Every week I read at least one research. In fact, almost every day I read a research in this particular field, and share those research with our team so that they can see what is current, what is modern, what is up to date. So research is very critical, and gaining that knowledge and insight into new technologies and new innovations and new discoveries is what we may help those what is helping our clinicians. And these are what we look whether the person, one, has the ability and the interest and the desire to learn new things, to update their knowledge on this research. Then those research is also the theories that supports it, because in school they teach you theories and then that's all, and then you read the research and that's all they gave you coming out of school. So for us, we want to see if the person is improving in their own professional development and capacity, and also this will also provide to our own clinicians through the resources that we have put together in our personnel management and human resources administration. So that is why at Care Solutions, those that seek for career or look for opportunities at Care Solutions better be prepared to to allow rigorous approach and also rigorous work, which is actually very fulfilling. And you can stay here 6 months without improving or developing. Every day or every week or every month, we expect that you learn something new working for us. This may be hard for some people. We have also come to people that say, oh, your business is too involved. I just want to go to a place I can just go and show up and do some work and get a paycheck. I don't have the energy and the strength and the time to be as involved as we are, which is fine. But for us, as a matter of organizational culture, building one of the best behavioral health system here in Maryland, where it is very competitive, if you know you have very distinct, pristine institutions like John Hopkins and University of Maryland. And I had spoken in the previously about how we've gotten offer a couple of times, even from John Hopkins, who wanted to buy our practice in the past, and even offered us a partnership, which we turned down at the time. But if we were not doing something good, they wouldn't be interested in offering us partnership. Maybe buying the practice because it's built up, but not offering us a partnership, and, which unfortunately we turned down then. But the point we are making is that the three factor that is very critical to you as a clinician is the research that I mentioned, the theories, the things that you do must be supported by some theories that has been tested and proven to work. The efficacy and effectiveness of our procedures is what we help to determine the outcome for every member of our program. So we want you to bear that in mind. Now, it's research and it's theories. Then the other thing is the practice, the way the practice is done. People have all kinds of practice. Some people don't care, as long as they show up or do whatever they like to do. But for us, the practice has to be principle based and it has to be evidence based. And that's where we look at also the long history of people experiences. But even if the person is new, we are fine, because it's also good to groom them when they are new. But the only thing is that we require that the person must be hungry for knowledge and to learn new things and to be able to improve themselves. If you don't have the hunger to improve yourself professionally, how can you help somebody who is struggling, who is mentally ill, to be able to get out of the situations? Because most of the time, even the Congress recognized the fact that the rehabilitation option is the best approach to help an individual who is suffering from mental health. It is more effective based on the evidence I have seen, which I have written in my books. It's more effective than treatment. Just the same wisdom the United States Congress saw in creating that option, that as a form of and the best approach, which they pay through the rehab options, through the health and human services Medicaid options, Medicaid programs. And some insurance companies under the Parity Act, which we fought for 10 years at the time, so several decades ago, some decades ago, actually a few decades, 1 decade ago. So is also very effective in a way that our services are delivered. So all these other things are things that we makes Care Solutions Corporation programs different from most programs in the country. So we also use this opportunity to thank our distinguished staff and our especially the older ones and who are very instrumental in mentoring the new ones who are new licenses because definitely they come to work unprepared when they begin to encounter the kind of populations and the problems that we have and realizing that the theories that is studied in college and graduate schools is not sufficient because every other environment is not controlled. So it's wide west, and then now have to rely on those that with that experience in order to make the best clinical decision. That's why we always insist on multidisciplinary approach and also multi-level approach and then team approach all together so that the people with all the experiences will be there to provide insight and guidance to those that are new clinicians until they begin to learn and feel comfortable to engage in certain practices and procedure. So, as I said, research, theories, practice, then the retraining that comes in that allows the transfer of knowledge and gaining new knowledge and new insight. So I encourage those that are new in the practice not to be intimidated because of the challenges that they may face or to feel like they are not ready. But you can always gain that experience and you can always rely in our professionals to mentor and groom and that can shadow you as you make those kind of decisions. For that is it's on the TV every day. Medical practice is the most sued profession in the world. Doctors, everyone you say my practice. Eventually, very soon, when they don't have enough doctors, as you can see, the doctors are dwindling in size and number, and nurse practitioners are taking place. They're going to start to turn on nurse practitioners. So that's why, for us as an agency that employ lots of nurse practitioners and use them, we encourage them to take the necessary step, whatever that it takes, in order for them to be able to uh, to to be strong, to be certain, and be sure of their knowledge and experiences and their practice as they provide the services to our members, and to know that there's always someone that they can always go to. There's always someone you can always go to and ask any question that where you need help or mentoring or shadowing or guidance, because that is your protection. Preventive medicine, as some people call it today, always an arising risk that is involved in the every particular aspect of the professional task, without affecting or delaying or withholding services. So we share our life for this purpose to make things easier for all our staff. So we encourage, especially my staff and our staff in all our programs, to know that we got your back and that teamwork is the way to go, and to know that there's no shame in asking somebody about something, because in this business nobody knows all. You are dealing with people who may treat you different or and treat another person different. That you're dealing with a population who may even be turned off for the fact that you see the accent that I have right now that may be different from their own, could trigger some other reactions, depending on the condition they have. It could make some other people paranoid. Some people's experience may be something. So you see why it is very difficult for anybody to say that you know it all, and why everybody is encouraged to rely and stay and work with the team, because it is through the teamwork that everybody can be able to make sure that the decision they are taking is the best that can bring the best outcome for the member served. For that is the purpose why we all gather together and go to work every day.